Good morning once again. Myself is Professor Dr.R.R.Deshpande. We are in the Ayurved College Nigdi, Pradhikaran, Pune 44. With me are MD first year students admitted in 2015, Dr. Kalyani, Dr. Basavaraj. Small group discussion is there. And today is a Wednesday, that is 9th of March 2016. First audio session is already completed where we have talked about ESR is a prognostic test and it is useful for tuberculosis and rheumatoid arthritis to check whether our treatment is going on well or not. And we, a little bit diverted from the main topic, and we have discussed a lot about tuberculosis and arthritic types, etc. Coming to the point again, I will request Dr. Basavaraj and Dr. Kalyani to talk about ESR in more detail. So there is one word about the Rowlex. Do you know about something? What is Rowlex? Yes, Dr. Kalyani.
Clumping of RBC.
Clumping of RBCs. Why? Why? Actually, RBCs should not pile on each other, or it should not have aggregated with each other, because they all are negatively charged. RBCs, everything is negative. So always there is attraction in between negative and positive. So what else is there in the blood? Basically plasma proteins and the cholesterol. So because of these charges, another positive charges, they stick to each other. So ESR, rather Rowlex formation is very essential factor in determination of ESR value. Remember, because it is nothing but a piling of RBCs on each other. But this piling occurs because RBCs are negatively charged, but due to the plasma proteins and cholesterol, they stick to each other and get piled over one another. This is Rowlex formation. Due to plasma proteins and cholesterol, they stick STICK to each other, RBCs, and then they piled up. मराठी मध्ये ढिगारा म्हणतो आपण त्याला. So now tell me, when the Rowlex formation is more, naturally ESR will be, what will be? ESR will be raised. That's right, because we use the Winthrop tube and we keep the blood in that Winthrop tube up to the mark on the top, because Winthrop tube has an advantage where we can calculate ESR as well as the PCV. There are values from 0 to 100. Am I right? So that particular consideration is over here. And let us see when there will be physiological raise of ESR. Physiological rise. There are only 4 conditions where the normal ESR is raised. In the pregnancy, then menstruation, parturition, and old age. These are the 4 conditions where you will get a little bit raised ESR. But when we say raised, you must remember the normal values. What are the normal values? Winthrop ESR?
15 to 20.
No. It's
Zero
always start from 0. 0 to 9 in the males and 0 to 20 in the females. Unit is mm, millimeter, at the end of 1 hour. So don't forget these values of Winthrop ESR, 0 to 9 for males and 0 to 20 for the females. When ESR will be low? ESR is low in the newborn babies. Always remember, in the newborn babies, it is only 0 to 2 millimeter per hour, and that is because of the polycythemia. What is meant by polycythemia? Excessive RBCs. Less is anemia and excessive is polycythemia. And naturally you can understand, when there is a burden of RBCs, it will go down very fastly. And what is the excessive pathological ESR? That we have already seen, that rheumatoid arthritis, tuberculosis, malignancy, and where there is a breakage, tissue damage is there, always ESR will be raised. tissue damage. And when it will be less, again the polycythemia in the adult as well. When RBCs count will be more, ESR will be less. And in practice you get CCF, congestive cardiac failure. These patients will have the less ESR. Okay. So the question will be asked like, what are the two methods, Western green and Winthrop? Winthrop is better because in Winthrop we can do the ESR and PCV both, but in Western green we can do only ESR. This is the main difference. This is the main difference. And another, how to see the reading. So ESR is always noted from top to bottom and PCV is from bottom to top. This is the difference. Yes, ESR always from top to bottom. So 0 is at the top and 10 is at the bottom. Then if we talk about the PCV, that is packed cell volume, what are the normal values? And basically how it is calculated. Which is the pipette that we use to fill that Winthrop tube? Do you know? Which is the pipette? Because its neck is very long. The front tube is very long. You have seen it in our lab or not? So that is called as a pasture pipette. Very long tip. Because it is very easy then to dip into the ESR or Winthrop tube. And how PCV is done? There is a little different method. ESR is a very simple. You have to just fill up that Winthrop tube, keep it in the ESR stand and wait for 1 hour. Put the label on it. Label is very essential in the practice as well. Name should be there, number 1, and at what time it has been kept. I have worked in the Godbole laboratory, and then the senior Dr. Ramesh Godbole, he used to get angry with the technician if he don't put the slip. Why? Because, for example, I have taken or put the tube at 10 o'clock. Then it is expected that I should check it on the 11 o'clock. But by chance that technician is some off the place, that he is not there at a particular place. If somebody has seen, okay, it has been put at 10 and now it is 11, so anybody can write down in the register. Okay, 11, after 1 hour, it has, the reading was like that. So, it is very easy to control your timing. So, what is the method for PCV? Have you done in our lab PCV actually? No. But you must do it by yourself, not with the English madam, not with the lab technician. You must do by yourself in your hand. So, how it is done? First, fill the pipette from the Winthrop bulb. You have to select the Winthrop bulb, take the blood in the Winthrop bulb, take in the pasture pipette and put it into the ESR tube and fill it from the bottom. Only while filling, you must take care that there should not be air bubble. That is a very important precaution. Then next, what you have to do? You have to put it in the centrifuge machine and you have to revolve it. Very simple, the name itself suggests packed cell volume. So when I teach to UG students in Marathi, it is very easy to explain them. The material is been packed. So RBCs, I have to pack it. Now for example, here all the students are there sitting in a different, keeping the distance in between them, and I have to pack you all. So I will put you in one vessel and I will revolve it. So automatically, because of the centrifugal force, always gather in the center. Similarly, in the centrifuge machine, we rotate that fluid and RBCs are get packed in that particular tube. So we rotate the centrifuge machine 2000 RPM for 30 minutes. Revolutions per minute, 2000 revolutions per minute. After 30 minutes, we take out the tube and see the reading from the bottom. And again we rotate it for 15 minutes. So one more rotation for 15 minutes. And we see whether the reading before and reading at present is the same or not. Rather it should remain the same. That means it is totally packed. If it is not, again rotate for next 15 minutes. Are you getting my point? Till you feel that the rotation has been enough to pack them, that time you have to rotate it. First 30 minutes, then 15 minutes, and if necessary, still more 15 minutes. And that will finalize everything. Now the final, there is a formula how to calculate height of the packed cell multiplied by 10. Height of the packed cells multiplied by 10. For example, I have taken the reading from the bottom because their bottom 0 is there and I have seen it is 4.2. So I have to write down 4.2 and I have to multiply it by 10, that is 42, and you must give it the unit as a percentage. So PCV is always in a percentage, ESR always in mm at the end of 1 hour. Are you getting my point? Here also you may get 1 hour to take the reading, but it is not we are keeping the stable. We are moving something in PCV and ESR it is a stable format. And I think you remember that PCV reading is useful to calculate the MCH and MCV, these indices during the course of this thing. Okay, let us move further about the BT-CT, bleeding time and clotting time, which is called as also hemostasis. One must remember that UG, it is allowed that make a confusion in homeostasis and hemostasis. Gross difference is there. Homeostasis is balancing the internal environment and hemostasis means to stop. In pharmacology there is another word. The medicines that stop the blood, what is the word for that? It is called as styptic medicine. STYPTIC. Styptic medicine. Means the medicines which stop the blood or help to stop the blood. For example, vitamin K, Caplin, injection Caplin. Now, when you have the wound and the blood is stopping, there are 3 things that is happening in your locally. Which are the 3 things by which the blood stops? 3 things are happening. 3 events are there, physiological events. Yes?
Fibrin formation.
Dr. Basavaj, yes?
Fibrin formation.
Okay. Anything else? 3 things. You are trying very well. Fibrin is the last step. Before that, vascular spasm, number 1. Vascular spasm, the blood vessel will get contracted immediately. It's like a shock, Whenever somebody make a pin to you, you will get shiver, like shock, contraction. So blood vessels, because of the trauma, it gets shocked and they get a vascular spasm for the contraction. Number 2, platelet plug formation. Platelets are also called as the thrombocytes. Cyte means cells and thrombo means a blood clot. So the cells which are useful for blood clotting, they are called as thrombocytes or platelets. 2.5 to 4.5 lakhs per cubic mm. This is the normal count of platelets. So immediately they rush for the help at the place of wound, and that is called as a platelet plug formation. And last is a coagulation. As you said rightly, that is a formation of fibrin. Normal. What is the difference in bleeding time and clotting time? In the bleeding time, only the first 2 phases are there. But in the clotting time, the next coagulation process is also there. Remember. So for bleeding time, vascular spasm is necessary and platelets are necessary. But to process of clotting, it will require some more time. So bleeding time is always less and clotting time is always more than bleeding time. So normal bleeding time is 0 to 5. I am taking very rough judgment to you just for remembering, specifically 2 to 3 minutes. And I always remember clotting time extreme for my practice. Forget about the official recordings. 5 to 10 minutes for clotting. I remember in this way. 0 to 5 for bleeding, 5 to 10 for clotting. Easy to remember. But if you want specific, 2 to 3 and 4 to 9. These are the book picture. But in addition, in our practice, sometimes we require some another factor that is called as prothrombin time, that is PT, and that comes around 10 to 25 seconds. 10 to 25 seconds. It is in second and BTCT is in minutes. Now next thing is in exam you will ask what are the coagulation factors. This is only for exam. I personally also can't remember all the time all these factors. This is very honest. But there are 13 clotting factors. You need not to write down everything. I will just read it for you. Coagulation factors are 13, but for exam purpose, for first year MD exam in June 16, and final year exam in 17 and 18, in June 18, you must mug up these clotting factors by heart. You learn it, not read it. Okay. First is fibrinogen, second is prothrombin, third is thromboplastin, fourth is calcium. Remember, calcium is essential for blood clotting. So if the patient is suffering from deficiency of calcium in the body, that we can check also in the laboratory, then the patient will suffer from clotting disorder. Especially this occurs in the old age, after the menopause in the females and after climacteric in the males. There is a problem of calcium deficiency. Even nowadays, any person, even in the young 30-year-old male or female, goes to the orthopedic surgeon because now this is a trend. Something you get here and there, they directly go for specialist. Now they forget about rheumatologists. They now go for specialist of shoulder pain, specialist of back pain. There are specialists now according to organ. And when you go to this type of the specialist, nowadays they always ask mainly 3 investigations. You might have heard about that. Any back pain, neck pain, arthritic problem, joint problem, bone problem, they do basic investigations without thinking anything. What are those investigations? Routinely done.
Serum calcium,
Serum calcium, very right. Dr. Kalyani said.
vitamin D,
Very good. Vitamin D, 100% correct. And vitamin B12. And lastly, bone density. These 4 investigations, they do at damn anything anyway. And then they prescribe a list of medicines containing the vitamin D, D3, containing vitamin B12, calcium supplement, B complex, what this and not. Then proteinules, protein granules, everything. But I think these cases must be taken by the Ayurvedic people, and they are very much definitely benefited by Ayurvedic management than the modern management. Because they spend their money in nearly thousands, minimum 5,000-6,000 they waste, and they found out that temporarily it was better, but again after 2 months the same heel pain has been started, same neck pain has been started. So there is no permanent cure with this type of medicines. So I prefer that you must go for Snehana Svedana, Pathya and Ayurvedic management for this type of the rheumatological problems. Okay. So we were talking about the clotting factors, and I have stopped at the calcium. Again I will continue. Fibrinogen, prothrombin, thromboplastin, calcium. 5th, proaxillary. 6th, clotting factor not named. 7th, proconvertin. 8th, anti-hemophilic factor A. This is most important. You write down this number 8. This is important. First you write down the number 4 as well, calcium. 4th, clotting factor, calcium. 8th, clotting factor, anti-hemophilic factor A. And 11th clotting factor is anti-hemophilic factor C. I repeat. 4th was calcium. 8th clotting factor was anti-hemophilic factor A. Then 11th was anti-hemophilic factor C. Others I will read again, just concentrate by years. So 8th is anti-hemophilic factor A, 9th is Christmas factor, 10th is Prover-Stewart factor, 12th is Hegman factor, 13th is fibrin stabilizing factor. Now, clotting process, there are mainly two pathways that you also must remember for your exam. In the written exam, it is always asked, describe blood clotting process. Write down this question, very important question. Describe blood clotting process. In Ayurveda, Rakta Skandana Prakriya Varnana Kara. Rakta Skandana Prakriya Varnana Kara. And there you must talk about extrinsic pathway and intrinsic pathway. Extrinsic pathway is concerned with the tissue injury. Extrinsic pathway is concerned with the tissue injury, and intrinsic pathway is related with the vessel injury, blood vessel. This is the main difference. So something is happening outside, something is happening inside, and together they build the clot. So what is happening outside, you must remember like a mobile numbers. I will give the number, that is very interesting. For extrinsic pathway, you write down 7, 10, 5. 7, 10, 5. So what does it mean? First, the seventh factor will come in the picture. With the help of calcium, it will stimulate to the 10th factor. Then together, all together, they will stimulate to the 5th factor. So 7th will stimulate to 10th, 10th will stimulate to the 5th one. So you must remember 7, 10, 5 numbers for extrinsic. Now for intrinsic, the number is big, but you must recite it or learn it by heart. 12, 11, 9, 8. I think it is in that way. If you have make some trick, it is easy to remember. 12, 11 to begin with. There is a gap of 10 because it is coming here on the left side. So 9 and 8. So 12, 11, 9 and 8. This is the mobile number of, this is joke, it is not a book description. Because some listeners who are listening Dr.R.R.Deshpande, they will be misleaded. Which book it is given mobile number? It is not like that. It is for just remembering 12, 11, 9, 8 is a number for intrinsic pathway. Of course, you have to add the next last upper two, 10 and 5. So total will be 12, 11, 9, 8, 10 and 5 for intrinsic pathway. Basuraj, is there any confusion? It is clear, no? So in this intrinsic there are 1, 2, 3, 4, 5, 6 numbers. Am I right? 12, 11, 9, 8, 10 and 5. So 10 and 5 are common for both. And here from it is coming 7, 10 and 5. Okay? Now, okay, after 5, further steps are very important that you must write down. Fifth factor, fifth step is proaccelerine. Proaccelerine. Fifth factor is proaccelerine. What happens next?
Intrinsic.
No, finally they both unite together. Are you getting me? It's 7 is stimulating to 10, 10 is stimulating to 5. This is externally. So fifth is ready. Okay? And here from here also. Fifth is also stimulated on this way. And how it is coming? 12, 11, 9, 8, 10 and 5. So anyway, you have to come to the 5. Am I right? And which is that 5? Is a proaccelerine. Into bracket, you write down prothrombin activator. Prothrombin activator. So another name, proaccelerine means prothrombin activator. And prothrombin word is much important. And it is easy to remember. Thrombin, prothrombin. Pro means before. Now what will happen next? Prothrombin will form thrombin. Prothrombin will be converted into the thrombin with the help of calcium. Okay? Prothrombin will be converted into the thrombin. One small thrombin. But thrombin will converted into the fibrinogen. Because finally we want the fibers. Because network should be there. So thrombin will convert it into the or stimulate the fibrinogen with the help of, always with the help of calcium. Don't forget it. Always with the help of calcium. And finally, fibrinogen will be converted because it is a gen means genesis. Fibrin will form. From fibrinogen, fibrin will form, but that is single. So that is called as monomer. When it is single one, that word is monomer, M-O-N-O-M-E-R, monomer. And from that fibrin monomer, the last factor will act, that is 13th factor with that monomer, who will mix 13th factor. That 13th factor, you write down the name of the 13th factor. The name is fibrin stabilizing factor. Fibrin stabilizing factor. And number is 13th. Are you getting me? So one fibrin mixed with 13th and of course calcium. Always calcium is there. So that will form fibrin polymer. First was monomer. Now it is polymer. Fibrin polymer. And fibrin polymer is nothing but the clot. Fibrin polymer is nothing but the clot. I think it is very well clear right now. If you ask the Rakta Skandana Prakriya Varnan Kara or describe the clotting process, at least you have the basic knowledge. What is intrinsic, what is extrinsic, etc., etc. Now, for performing this BT-CT, there are different methods in the laboratory. One is capillary method. You might have been done in your practice or rather in your colleges of BMS, where we put the blood into the small capillaries and we, after every 15 seconds, we break it and see whether there is a fiber is formed or not. But in the Godbole laboratory, I have seen a very simple, more easy method that we also follow in our lab. In Dr. Ramesh Godbole's lab in Pune, Alcott Chowk, we give the finger prick and take the blood on the slide. On two slides, we take the blood on the two slides. And then we take the blotting paper and every 10 seconds we dry that wound or we wipe out that wound. So I have pricked over here on the middle finger and then with the lancet and then I am wiping out with the blotting paper every 10 seconds. And that drop is seen on the blotting paper going small, small and small. So within a period of 2 to 3 minutes, that here the blood has stopped. Whichever I have pricked on the finger, that finger blood has stopped to oozing out. So that ends the bleeding time. So I have got the bleeding time on the blotting paper. In my inner mind setup, I know that clotting time is always more than the bleeding time. So till this stops, I do not worry about the glass slide. After stopping, I give the swab to the patient and keep it in the hand. By chance, if it afterwards also oozes, it will, but generally it is not necessary also. Don't give even the swab. Then I take the slide and then with the lancet itself by the another end, I start just looking into the fiber formation. Just I lift the blood drop and when I get a fiber, I can lift the blood drop with the thread. And when I see that thread, that is nothing but the clotting factor. Ideally, it should be done with the stopwatch, but in practice, you can do with your wristwatch as well. Remember, this is very easy method. In spite of the capillary method, I always prefer to do glass slide method. This can be called as a glass slide method and it is allowed, it is official, it is practiced by the pathologist and you can confidently do in your exams of June 16 as well. Okay. So this is the practical approach of BT-CT. But next, when you will prescribe to do this BT-CT? So normal values we have seen. Now tell me the conditions where BT is increased. It is not stopping within 5 minutes. It is moving still at till 10, 12, 13 minutes. What you will suspect? Why bleeding time has increased? What are the basic reasons? What is the important reason? Which is the main disease, yes?
Disease, bleeding disorders.
Yes, that's what I am asking you, madam.
Hemophilia.
Very, oh no, oh no, galat jawab. If there is Amitabh Bachchan at the anchoring, he may say, oh, galat jawab. I am talking about bleeding time. Bleeding time is concerned with the platelets, remember, Dr. Kalyani. So platelets are less. That is called as thrombocytopenia. And that disease is called as thrombocytopenic purpura. You write down these words, thrombocytopenic purpura. This is the commonest problem when BT is increased. And when we talk about total clotting process, clotting process is not simple, remember. Bleeding is simple, clotting is complicated. These 13 factors and intrinsic, extrinsic, this and that and calcium, so many things are there. And that's why you have written 3 factors. You can check that factors 8 and 11. They have this word, what you said, hemophilia. So when clotting time is increased, the probable cause will be hemophilia because of the deficiency of that anti-hemophilic factor. Anti-hemophilic factor. But when there is increased, what you can say, the clotting time, it is not only these factors number 8 and 11 are lacking, but there are some other causes, for example, liver diseases. Because all these clotting factors, many of these factors are prepared in the liver, remember, are prepared in the liver. Liver is an industry. So when problem of liver like cirrhosis and cancer, these are the commonest. Cirrhosis is common in the alcoholic patient. Then you will get this type of the problems. And another is obstructive jaundice, because vitamin K is not absorbed from the intestine. In obstructive jaundice, vitamin K is not absorbed from the intestine, and vitamin K is essential for formation of prothrombin. Now these are the 2 important things. In practice, when we suspect these diseases, we always ask to do the BT-CT. But otherwise also you remember that before any surgical process, especially major surgeries or even minor surgeries, we do this BT-CT, even the PT. Why? To avoid the complications of post-surgical complications of excessive bleeding. But here I would like to add, in Ayurvedic, one of the Panchakarma also, you must do the BT-CT. Because there are mishaps that I have seen that has happened because of the negligence. Which is the condition where you must do the BT-CT. Rakta Mokshan, especially Jalaukavacharan. Before the leech application, it is better in this Consumer Protection Act, it is always Ayurvedic Vaidya should do the BT-CT. Why? Because it contains the hirudine. The leech contains some factor in the saliva, and that can also interfere with your blood clotting process. So before application of leeches, you must perform to rule out these diseases like purpura or the hemophilia problems. Now we will take a short notes of idiopathic thrombocytopenic purpura. What is this disease? So write down the title ITP. ITP. So idiopathic thrombocytopenic purpura, which is also called as immune thrombocytopenic purpura. It is seen in the children and adults. In the children, it is basically starts after the viral infection. Then main symptoms, number 1, easy or excessive bruising, easy or excessive bruising, BRUISING, bruising. Then superficial bleeding, number 2, into the skin, superficial bleeding into your skin, and you will get a pinpoint sized reddish purple spots, reddish purple spots, which are called as petechiae, PETECHIAE. So whenever the children comes to you that his mother telling you that see the child has a dots, reddish dots, so you must have this mind, it may be the purpura. Then next is third point, prolonged bleeding from cuts, prolonged bleeding from cuts. We get minor cuts with the cutting our vegetables and these things, and even the sharpening our or cutting our nails, and you get a lot of bleeding, and you cannot understand why bleeding is so much. Then you must suspect there may be purpura. Next is symptom I am talking about, spontaneous bleeding from nose, spontaneous bleeding from nose. Then next is bleeding gums after dental work. Dentist is not suspecting so much bleeding should come from the gums, but the patient is experiencing excessive bleeding from the gums after removal of the tooth and etc. Then he must suspect that he may have the blood dyscrasias. What you are talking about, blood disorders, bleeding disorders, it is also called as a blood dyscrasias, where all these, in Ayurveda it is called as Rakta Pitta. In Ayurveda the Vyadhi is called as a Rakta Pitta, where you get a different types of the bleeding disorders, blood dyscrasias. So we are talking about purpura. Next is blood in the urine and stools, blood in the urine and stools without specific reason, that is most important, without any specific reason. For example, if their patient is of renal calculus, then bleeding is okay, hematuria. If the patient is having hemorrhoid piles or the fissure, then is having the blood, it's okay. But you can't see anything abnormal with concern to the hematuria or the blood in the rectal, then you must do the BT-CT always. Next point, is about the excessive menstrual flow. Excessive menstrual flow, that is the menorrhagia, polymenorrhea, metrorrhagia or polymenorrhagia. In all these conditions, if you find uterine fibroid, sulfingitis, uveitis, pelvic inflammatory, no problem. It is very clear. Because of this, she is having the menstrual problem. But there is no female reproductive system problem and still she is getting the symptoms, then you must do this minor test of BT-CT. Thereby you can find out the blood dyscrasias or bleeding disorders. Next is fatigue. Fatigue without any specific reason. The cause of this purpura is idiopathic, no specific cause. So write down idiopathic. Some call it as a autoimmune disease. And what is meant by autoimmune disease? Antibodies are developed against what? Against platelets. Why the platelets are destructing? Because of the antibodies formation, which should not be. Then complications of this purpura is excessive bleeding, especially in the brain, which can be fatal. The treatment is of course the prednisolone in the modern medicine, but you know that you must write down the side effects of steroids that will be there. If the patient is taking the Visolon or prednisolone for a longer duration, he may develop after some time osteoporosis, side effect of the steroids, osteoporosis, cataract, motibindu, diabetes mellitus type 2. Of course, for purpura, if the steroids are not working, the last measure is splenectomy. That also you must remember. Splenectomy. Then next, after 2 lines you write down the disease as a hemophilia. We will write down something about hemophilia. This is basically, as you said, deficiency of factor number 8 and 11, clotting factor deficiency. And mostly it is inherited genetic disorder. Inherited genetic disorder. The symptoms, main symptoms are: number 1, unexplained and excessive bleeding from cuts or injuries. The same like purpura, unexplained and excessive bleeding from cuts or injuries or after surgery or dental work. Number 2, many large or deep bruises, BRUISES. Third, blood in your urine and stool. These are all same like purpura. Blood in your urine and stool. And most important is pain and swelling in your joint. That hemarthrosis is common in hemophilia than thrombocytopenic purpura. That means you get a blood collection in the big joints like a knee and elbow, and that is something emergency. So I will also describe you emergency signs and symptoms of hemophilia. Number 1 is sudden pain, swelling of large joints like knees, elbows and hips. Number 2, painful and prolonged headache, repeated vomiting, fatigue, neck pain, etc. Then complications: deep internal bleeding, like in the deep muscles. Then damage to joints, then infections, especially because hemophilic patients need more blood transfusions, BT. They will repeatedly require the BT, and contaminated BT can give risk of infection like HIV or hepatitis B. Then treatment is dependent upon mild, moderate, severe. Mild hemophilia A, injection of hormone desmopressin, DESMOPRESSIN, can stimulate more clotting factors. Sometimes this is available also as a nasal spray. desmopressin. I remember the use in the its market available is called as a devoid nasal spray, which contains the desmopressin, and it is used in bed wetting for the small children. That is also used in that condition. Then moderate to severe hemophilia A or B. Of course, you have to give the repeated BTs with clotting factors. Hemophilia C is more common in the Europe and not over here. Anyway, I feel that this may be our concluding part of our audio session, because again we have completed nearly 45 minutes. So once again I thank you for your patience hearing. Today is Wednesday and 9th of March 2016. In front of the MD first year students, we have discussed about ESR, PCV, and now in this session about bleeding time and clotting time, with description of some diseases like tuberculosis, arthritis, hemophilia, and also the purpura. And also we have got a very important question, LAQ, like Rakta Skandana Prakriya Varnan Kara. So I thank you for your presence and patience hearing, and I wish you a nice day ahead. Thank you.